I am so grateful to our speakers for agreeing to join us today. Dr. Enrique Gonzalez-Mendez is the chair of the board of the Latino Health Forum, and you can imagine just how busy his life is in general, but at these times, really spectacularly. And he is going to give us an overview of what's happening locally in terms of health disparities and COVID. And Dr. Mohamed Salem from our very own electrical engineering department at Sonoma State is going to share with us about information literacy, how to read all those charts, and what does 5G have to do with COVID. So I'm so very pleased that they both have agreed to help us out today and share their knowledge and wisdom.
Thank you, Meredith. And I would like to welcome Dr. Enrique Gonzalez-Mendez to talk about the COVID-19 and the Latinx community in Sonoma County.
Thank you very much for inviting me. It's always a pleasure talking to people. And Sonoma State has a long story of helping our community. Many people don't know that it was a teacher of Sonoma State that got a grant that started the first bilingual public radio in United States, KBBF, in Santa Rosa. And it was Sonoma State who started that 45 years ago. So among many other things that the university has done. Last year, we have the Latino Health Forum every year with the residents. I'm a teacher at the residency, and I've been teaching for many years. The residency in family medicine at Sutter, before was community hospital, now is Sutter. Then we have this event every year, and this year we have the 28th year. Last year, somehow, talking to people, we thought that the topic should be discrimination and health, without knowing all these horrible things that are happening, and especially without knowing that we'll have this COVID and how this will show the difference between different populations and access to health. The slides that I want to show are from basically from a presentation of the public health officer that she gave a presentation during our week event this year, Dr. Sundari Mays. There's some of them are a little bit old, a month or two, but it hasn't changed basically what is happening in our community and in probably entire California. So the COVID-19, despite the fact that the federal government is saying that it's just a cold and maybe allergies, is very serious, as you know, and is causing the death and misery of many, many people. So this slide is showing you what is the source of the infection. And for months we were not sure, but now we know that it's close contact. That's why using a mask and keep distance from each other and not being in groups, especially indoor, is crucial. So you can see this greenish color that is the main source of infections. Under investigation is because we unfortunately don't have the capacity of following all the contacts that people, because we are not doing enough testing, then we cannot follow. So from the epidemiology point of view, it's pretty hard to see sometimes where the people got infected, but we know that is close contact, the most frequent cause. Next, please. Unfortunately, the community. I came from Denver in March, and there were 4 cases in Sonoma County. Four people dead. Now we have 98, and probably more that we haven't made diagnosis because we don't have the test. And as you know, but sometimes people says is a cardiorespiratory arrest, and everybody dies when their heart stops, or the heart stops when people die. So that's not a diagnosis. So 98 probably is more, and the total, as you can see, is more than 6,000. Some groups are talking about a lot more numbers in United States by the end of this year. Probably have 400,000 people there. And again, we don't know. And we don't know, especially in the Latino population, because, and we've seen that in Mexico, especially in Mexico City, where there is a lot of cases because of close contact, that people are afraid to go into hospitals. And people are afraid, on one hand, because they believe that if you go to a hospital, your chances of dying are higher, but also because people don't have insurance. So Latino patients, they know that they can lose everything and can be thousands and thousands of dollars if they go to a hospital. So we really don't know. But this is what the public health numbers are. I'm seeing that the Press Democrat, the numbers of new cases are terrible, are just terrible. Every day, hundreds, and especially after, as you know, after these holidays when people just go and be together. Next, please. Someone, and I think it was the Census Bureau, put this population, call it Hispanic. I personally don't like Hispanic because we are not Hispanics and we don't even speak Spanish. The language that we speak is Castellano. But they say, oh, Hispanics. So, and at least in Mexico, there's still a lot of resentment for the people that came and conquered and destroyed half of the population there. But well, Hispanic, Latino, Latinx. So you can see that, and this number was higher. 52% of cases are in the Latino population, when the Latino population represents probably 23% of the population of the county. At a certain point was 75% of cases in the Latino population. And this proportion, as well as with blacks, but there's not too many African Americans in the county. That's why the numbers are so low. But we've seen in other places that African Americans are a lot more inflicted with the coronavirus. Next, please. So a word, something that is very important, and trying to understand why the Latinos, being a very healthy group of the population, as you know, immigrants in general are healthier, and people that migrate are healthier and younger, stronger, but then they get sicker as soon as sick with the time of acculturation and so on. But as you see, these are some of the situations that can cause transmission of the disease. Latinos, because they make less money. Then they have to work outside, and rarely they can work in their home from a computer. And we live several generations in one house. You have patients that working at Cloverdale Clinic that they live 15 guys in one apartment, 15, 18. So that is perfect for people to get sick with in this case with the virus. But I've seen that with other disease that can be transmitted. Why is this? Well, it's because rents are extremely expensive, and also it's a cultural situation where we want the grandparents to live in our house and help with the kids, teaching them what these old people know. So it's very cultural. I used to say that there were more nursing homes in Sonoma County than in Mexico City. That is a city of millions and millions, because it's not part of our culture. We keep the family together and to help each other. So you can see that household contacts are very, very one of the main problems why Latinos have more these infections. Next, please. So basically, here, sorry, the numbers are not very clear, but the Latinx community is younger. The vast majority are under 50. But why we have more cases, close contact, and often no symptoms. And this is really a problem, because when people don't have symptoms, then they feel they are not sick. And then, or they have symptoms but not too bad, and they keep working, they can doing their life, and of course they can infect a lot more people. This is really a problem, because if we open the schools, children in general have less symptoms, or they express their symptoms less, and they are highly infected. So Latinos in general, even if we have a big problem with obesity and diabetes, but in general, they are less likely to have an underlying condition or to be hospitalized. And again, they try not to go to a hospital. Latinos, in my experience, they go to community clinics, and but hospital itself, ER, urgent care, in general, we try to avoid it. So next, please.
Yeah, and doctor, just wanted to let you know we have 3 more minutes.
Wow. Okay, so I go very fast. So this is just the age. Latinos are younger, as we said, and unfortunately, the most cases are from 17 to 50, so affect more Latinos. Next, please. So close contacts, we talk about it, and it's again, we live in the same house, and people go and work and come maybe infected from a co-worker that is asymptomatic. Next, please. No, I'm going to go very fast. No. As we said, in general, Latinos have less possibilities of, less likely to be hospitalized than non-Latinos. again, we have these allergies to going to a hospital because we don't like to be diagnosed of something that we don't think we have. Next, please. Oh yes, we talk about the underlying conditions, especially smoking, and especially women. They in Latino population, they smoke less and they have less cardiovascular disease because we're younger. Well, the younger in the Latino population is younger in general. So less likely to have other underlying conditions. Next, please. So this is a very important slide. As you can see, there is no white population of people working in agriculture. None. Well, probably 2 or 3. But you can see most people working in the field are Latinos. And that means close contact. That means having a mask after a few hours is impossible. So that's a place where people can get infected. And you can see it's a little bit busy, but there is when I'm, at least in my experiences, where most people in agriculture and services and sales, that are a lot more Latinos still working and still exposed to the coronavirus. Next, I think we're almost done. Oh, sorry, this we already saw this one. Again, unfortunately, not everybody can work from home. Latinos make less money than others, other groups. Live in poor neighborhoods where it's hard to find fresh fruit and vegetables. As many people now saying is that your zip code is probably most important than your genetic code for disease. So your zip code determines in many ways the mortality and morbidity in many groups. So low income, the people have to work sometimes 3 jobs and being more exposed. So I'm talking about Latinx. So next, please. Tell me when I'm done. I'm done. Okay. So I will be happy to answer any questions. The fact is that disparities and discrimination in health are very clear now. It's very, very clear that people with less money and people of color, we have less access, and with the COVID, well, we are going to have more patients, more cases, and more people are going to die probably, even if we are younger.
Thank you, Dr. Gonzalez-Mendez, for sharing this important information with us and the impact on the Latinx community.
My pleasure.